Mary Vanderlei is chairing an advisory panel on cardiovascular medical devices. The panel includes 2 consumer members, researchers, clinicians, and other providers.
These guidelines should definitely include something about the ICD. That's one of my areas of research, and I really know a lot about the topic. I also have some papers that I would like cited.
I'm sorry to be so out of it, but what exactly is an ICD? How does it work? How does it work in a person?
So ICD stands for Implantable Cardioverter Defibrillator. It is a battery-operated device that's placed under the patient's skin and is connected to the heart. So when the device detects an abnormal heartbeat, or if it's too fast or if it's too slow, it sends the heart an electric shock that restores the heartbeat to normal.
An ICD is a defibrillator that can also have a pacemaker included. ICDs are useful in preventing sudden death in patients who have ventricular tachycardia or fibrillation. And there are many studies that have shown that they can prevent cardiac arrest in patients who are at high risk.
And how do you decide who's at high risk?
So that decision is mainly based on whether the arrhythmia is life-threatening. And in addition, we need to rule out other potential causes of the arrhythmia. For example, a silent heart attack, or drug toxicities, and other potential causes.
If you all decide to make recommendations about these devices, can you make sure they're in plain language and the pros and cons are also explained in the recommendations?
Well, okay, but I think that doctors will understand these terms and the pros and cons of the ICDs. Can patients just look up these terms whenever they read the recommendations?
Well, let's see what we can do. I think Barbara has brought up a lot of important points, and we should try to make our report accessible both to laypersons and health professionals. I suggest we add a glossary to our report.